Do you think newborn screening should be implemented by the state government or the central government? So now the central government, as a part of Ayushman Bharat, has also incorporated newborn screening, but the events haven't still taken off very well yet. So how do you see that?
I think that for anything to be effective, it has to be a national program. So most other health-related national programs have got a central directive and a state execution. And I think that would be the best way for a newborn screening program to go forward on a mode that is equivalent to the universal immunization program.
Okay, so but how do you account for the diversity of the nation in terms of, let's say, availability of resources, the genetic diversity, and also how things work pretty smoothly in some states but not so well in the others?
Well, that's a very important question and a very difficult question to answer comprehensively in a few seconds to minutes. But the thing is that unless we make a start and unless we start the program, perhaps with a few diseases that are of national priority, we could include the 2 diseases and maybe a couple more. The genetic and population diversity throughout the country and the access to people is always going to be difficult. But unless we make a start, we are not going to succeed. We've also in the past spoken about the infant mortality rate. Whenever countries are improving their infant mortality rate, and once it goes below 40 per thousand to 30 per thousand, these diseases take a priority. So we need to identify them early to reduce the mortality and morbidity.
Do you have anything more to add to whatever we have already discussed?
I think if I had to say one thing, I think for our country to go forward, this is probably the most important single public health measure that we need to introduce, although late, into our health system to avoid much more incidence of these births that can easily be treated.